Battling an insurgency that has raged on for more than a decade, another humanitarian crisis is gradually unfolding. It is malnutrition which is threatening the lives of both the old and young in the region. According to the United Nations Children's Fund, UNICEF, malnutrition is the biggest threat to child survival and development in the northeast, and the insurgency in the region has worsened food insecurity with the destruction of farmlands and food crops. About 1 million children in the northeast are said to be acutely malnourished, including over 600,000 facing severe malnutrition. I have with me in the studio founder SafeBody.com, Dr. Azizat Yishao, in the studio. Thank you for joining me.
Thank you for having me.
Now, how concerning is this development? About 1.15 million children aged between 6 to 59 months are seriously malnourished, and about 600,000 of these are falling into the acute end of being malnourished.
Thank you very much. I think from the data we can understand that it's extremely worrying if we have large number of under 5 years old who are extremely malnourished, and we know that we have a not so good statistics with under 5 years old death and neonatal deaths as well in Nigeria as well. And so malnutrition is a great part of some of those data as well, and so it's a great concern for any country that is concerned about food security, about health as well, and so it is a huge concern for the health sector as well.
Now, how does the aspect of food security that we are facing, because there has been talks of looming food crisis, food insecurity, how does that compound this figures that we're already witnessing?
Okay, so in terms of malnutrition, we talk about direct or immediate factors that affect malnutrition, and one of the aspects is nutrition itself, is food itself, the ability, and when we talk about young children or even adults themselves, is the food available? Are they able to access those foods? So in terms of food availability, we talk about food security. Are we producing enough? Do we have agricultural capacity to provide and feed the nation? Do we have an agricultural value chain such that agricultural produce are produced in order form to feed the country as a whole? So when we talk about this nutrition aspect, we talk about underlying causes that might directly affect availability of food. And in this case, in the northeastern region, aside from what we have as an economic development or structural development, we have an insurgence that is constantly disrupting the development of such an economy, and we have these people losing their means of livelihood, moving from one place to another to settle or settle comfortably in other locations as well. Right. So the insurgence is bringing a great instability, you understand me, to food security. It is affecting even what other efforts that might be made by the country, policies, budgetary or agricultural allocations to boost food production. But the consistent insecurity, the consistent injustice is toppling that effort as well. So it's going to continue to be a loop, you understand what I'm saying, in the capacity of the country to provide food security.
Expatiate more on this underlying factors. Aside insecurity, what more should we know that is threatening or causing this malnutrition, the figures that we're witnessing?
So aside from nutrition, which is the food available, we talk about the disease aspect of malnutrition. So while a child might have good food, let's assume, or average amount of food or nutrient in their diet, what about disease conditions? And one of the major causes of malnutrition in terms of disease is diarrhea. You understand me? So during diarrhea infection, of which we are facing a major challenge now in this same region, which is cholera. You understand? So diarrhea disease is also a form of a major cause of malnutrition in underage and even adult as well when this infection comes up. So we have cholera, we have dysentery, we have other form of diarrhea disease that may affect this vulnerable group of people. And one of the things that would continue to cause disease condition is what is the personal hygiene of the caregiver, what is the environmental and water sanitation hygiene. Do these people have access to clean water? Do these people understand what environmental hygiene is about? What is the community response to immunization? Because immunization is also a key aspect to prevent disease condition, especially in underage, in under 5 years old and neonatal. So things like the rotavirus and other form of immunization, what is the community response? What is their awareness and understanding that their actions or their refusal or behavior towards medicine, immunization, access to clean water, water purification, ensuring that, the personal hygiene when preparing food for their family and themselves affect, have a direct effect on the development of their child or even the overall health of, of individuals. Child. Yes.
Now, so talk to us then. When do we begin to see issues of acute malnutrition? We have malnutrition and then we have acute malnutrition, according to reports. Yeah. At what point do we begin to say this is an acute situation? What's the difference, basically?
Okay, so for malnutrition, you can have a general, maybe a slowed development. You would see that the numbers are not extreme, you understand? So when we talk about acute malnutrition, we're talking about the starvation, you understand me? You can see a situation whereby the people or the children, underage children, do not have extreme developmental or health, how would I put it? There's an extreme developmental challenge, you understand me? So such children or such group of people do not have access to any form of nutrition and are particularly exposed to to disease conditions. So in areas such as the northeastern region, which we know that first of all this insurgency is coupled with the COVID-19 factor as well. You see people who have moved from their normal settlements to the IDP camps. You understand what I'm saying? One, they do not have access to quality food. You understand me? And then there's disease condition because there's overcrowding and there's lack of access. So in this situation, you would see acute and extreme, malnutrition in such group of people, such that they fall ill, they continuously fall ill or have health challenges as well. So, but for malnutrition, an average or mild malnutrition, we could talk about, okay, are these people having a balanced diet? I'm usually focused on the 5 years old because their dynamics is very sensitive. So so that's what we talk about. Okay, do they have good protein diet? Do they have minerals and iron in their diet? So you could say, oh, your child is, you could take your child to the hospital and say, oh, your child is anemic, is lacking some form of iron, some form of B complex and stuff like that. And then you could reverse that process by normal complementary food or stuff like that. But in terms of acute or extreme starvation, you see a lack of access to food, good food, quality food, and there's a disease component to that.
So what does it take to reverse that kind of condition?
Yes, so I'm focused also, generally in Nigeria we have several challenges in the health sector, but we're talking about focusing on the northern region where we know that there's an active disruptive factor, which is the insurgents. I believe that for each military expedition, it should come with an humanitarian expedition as well. We have a Ministry of Humanitarian Affairs in Nigeria. So their work as well must contain not only short-term but moderate and long-term plan to comfortably settle and provide a sustainable maybe mini or micro economy for Nigerians who are moving into other areas whereby they can be able to have access to food. You understand me? They could earn some form of income, and then there needs to be adequate information. I think information and awareness is very, very important. Irrespective of where you have these people, they need to know what breastfeeding, how important it is to ensure that when you are breastfeeding your child, you are doing so properly. When your child is coming up with diarrhea disease, what are the things that you're supposed to do? And I think WHO is we're trying to encourage the good oral rehydration practice. That is, when your child is having diarrhea, what do you do? We have some culture that people stop breastfeeding that child or stop feeding that child
because they feel because of the breast milk.
Yes, that is a wrong idea. You understand me? The idea is to continue to give fluid intake, continue to give IDP food, ensure that, you know, the means of contamination for that child is removed. You understand what I'm saying? It might be the water, it might be contaminated food, it might be your hands, you know. And then other awareness that we discuss is about, you know, where do we situate your waste? Where do you situate particularly fecal matter? Because one of the causes of, one of the means of contamination of food and water is fecal matter, which, you know, serve as an host for, you know, bacterial infection and the rest. So when you create awareness in these regions as well, coupled with intervention, because I believe that at this stage we need to continue to seek for help. This is not the time to keep quiet. You understand what I'm saying? To offset some of the effect of the insurgency, to offset some of the effect of COVID-19, because we have to also focus on that as well. To offset some of the delayed, you know, development, structural development, water and sanitation infrastructures that we have, particularly in this region. There's something that we do down here in Lagos. I don't know, I'm not sure of other countries, that when we are able to have, you know, women come to the hospital for their maternal immunization, this is an opportunity to speak with them on how to, you know, for personal hygiene, how to, even yourself, you understand me, how to, you know, have, you know, an hygiene and clean environment to prevent, you know, infectious disease.
Earlier, you mentioned the aspect of we asking for help, and I'm wondering, in what aspect now should we be asking for help? Are you talking about dealing with this issue of malnutrition, or asking for help in general to address the issues of insecurity that is at the heart of this?
I think that for both, for the purpose of this topic, we're focusing on malnutrition, and because of this particular, from what you read earlier, because the focus is on a particular region, there's constantly, you know, there's a factor that's constantly disrupting what will have been normal effort. So I was saying that, you know, last year when the COVID-19, you know, there was a lot of effort being pushed into the IDP camps to provide support and stuff like that. And I think that the government should not, or stakeholders, not only the government, stakeholders and other, you know, organizations that are particular about this area should continue the effort, you understand me, to ensure that there's some form of stabilities, even in these resettlement camps, you understand what I'm saying. I've seen some of the report, you understand me, some of, even in these IDP camps, they are not proper, you know, facilities to ensure a clean, you know, environment as well. So
that has been a major challenge. Now, I was asking earlier that if we are to reverse, you talked about how issues of malnutrition can be reversed.
Yes.
And then I was looking at the case of acute malnutrition, how it can be reversed as well. Basically, what is necessary, because you talked about the fact that there's disease involved when you talk about the aspect of acute malnutrition. How can it be reversed? Okay,
so in terms of, just like I said, first of all, we've talked about the two immediate causes. Is the food available?
Yeah.
And then in terms of disease as well, I think that one of the things is that, you know, awareness and information is very important. Two, we need health and sanitation infrastructures or facilities available, you understand? Because when, for one reason or the other, if a child is infected or has some form of infectious disease, you understand what I'm saying, that would cause malnutrition, like I said. Diarrhea disease is one of the major causes of malnutrition.
So it is to address the diseases in the child?
Yes, and to provide facilities, you understand, that will ensure that people, when they are able to, you know, present at those hospitals, they are able to identify those disease conditions as well. And it's mostly, you know, on prevention mechanisms. You know, so I think I've talked about it. Keeping personal hygiene, what are the importance of keeping personal hygiene.
Focus should be more on prevention.
Yes, on prevention, you understand me. So what are the things that would expose or cause, you know, infection in children or in adults, you understand me, that will cause malnutrition? If we are taking the aspect of access to quality food, access to a good diet as well. So information is very important, that gets us to people that these are the things that you are doing that would, you know, expose you to malnutrition, and then government ensuring that such facilities to assist people, you know, to seek help is available. So that's my own point of view.
Right. Now, when we're talking about nutrition for a child, what constitutes the right form of nutrition for children within this age bracket that we are looking at?
So, yes, so I think that for the age bracket, in this, there's a lot of development going on, and so I think that some of the things that should, you know, not only exclusively to the list is that, you know, a good protein diet, is always very important. A good mineral and vitamin diet. So we encouraged mothers when they are trying to provide food for their child that, okay, you must ensure that the simple basis of balanced diet. What are you giving your child in the morning? What are the constituents? Does it contain the iron? Does it contain the vitamin A? Does it contain adequate and proper protein? Rather than junk food, rather than, you know, quick fast food. So for any child in this particular age group, you would expect that such child should have a diet that is highly rich in protein. So we discuss with mothers, how can you have protein in your child's food? The food, fish. We talk about egg. You understand what I'm saying? We talk about, you know, beans compared to what might be readily available. So that, you know, people be like, once you've taken gari or we've given you rice, that should be enough. You know, you expect that child to grow. So, and we have this, oh, right, I cannot afford this, I cannot afford that. So we talk about other means. You know, beans is good, soya beans, it's good. You understand me? Is to make an effort because of the, depending on the level of economic capability of the parents to provide, you understand? But I remember when we were growing up, we were always told that, oh, you couldn't eat meat, you understand, because the meat was for the adults. They are all grown up, you understand me? So in that, so we encourage that, you know, in that age group, how do you
give the meat to your children?
How do you put the vegetables in their meal? You understand me? We encourage mothers to give the, we have, I don't know the English, ewedu, okra, you understand? So that the things that we encourage for you to give your child, and you know, reduce the amount of direct starch that you might be giving them, or other form of sugar, you understand, that you be giving children at that age group. And then, you know, so that is, you know, that is the advice that we, and if you could, the more you could afford, then the better the meal should be as well.
Now, when you look at these figures that we reeled out, talking about 1.15 million children aged between 6 to 59 months being seriously malnourished, and all of it, what does it say of our commitment as a country to addressing these issues? We've been signatory to several SDG goals, MDG goals, and all the goals you can talk about. But when it comes to effort and implementation, something seems to be lacking.
Yes, I agree. I think, because I like to, you know, directly answer that question, it is poor. You understand me? And there's a reason why, you know, we could say, oh, these are the factors that are affecting a poor implementation, and you know, what is the political will, what is the strategy, you know, to ensure that, you know, it actually works out, what is the implementation policy. I think one of the policies, you know, to ensure that, okay, everyone has access to good health care is the primary health care system. And you realize that in this region, you know, some communities, you understand, you can have one primary health care is non-existent, and you can have one primary health care, you know, servicing, you know, 10 to 20 communities of people with reduced, you know, with lack of facilities or human resources or reusables, as the case might be. And some of these communities as well, you know, there's a you want to ask what is the political commitment to ensure that there are structures available in those places as well. So to directly answer your question, it is poor. But can we do better? Do we need to do better? Then the conversation is yes. We are not doing enough. You know, we cannot just focus on a few places and say, oh, everything is right, because data is showing us that whatever it is that we are doing is not directly giving us an improvement that, you know, that we need. You understand what I'm saying? So is either we are getting it on one side right, and then the other side, you know, is suffering from it as well. So yeah.
So do you think that one of the factors that come to play, because some might say that perhaps religion also has a major role to play with what we are seeing? You mentioned vaccination earlier, and some other things, and some will tell you religion plays a major role here in decision making and why we're seeing some of this results. Yes,
I agree with you, because beliefs affect, you know, what each and everyone does. And then what I try to say is that some of the, I believe that if we're going to have any development, particularly in the sector, I'm in the sector, is the onus is on those who practice, the health workers, those who understand. I speak to people that each time you want to convince someone what you learned for a minimum of 6 years. You understand? In med school, I've been told about the benefit, the whatever on vaccination, how it goes. So I particularly understand. And within a few 30 minutes or something, you want somebody else to pick up that belief. Someone who probably is not exposed to any form of education.
Right.
Someone who who has their own history of health, or their own history of medicine, you understand, that's culturally passed down, religious belief of medicine
tradition
as well, and tradition and the rest. So it takes a lot of effort for behavioral change, and then it takes trust. You understand what I'm saying? First of all, I said the distrust for advanced medicine is all over the world. You know, some people, we have it with vaccine. We have huge campaign against vaccine in some advanced countries as well. So, but for us in Nigeria, one of the things that we have to ensure is that we gain the trust of the people, and trust comes from consistently delivering on a particular promise, consistently showing. You understand me, on a particular promise. In this particular specific region, the pain of the polio vaccine saga is still a story that is being told again, again and again. You understand me? And it takes continuous commitment and empathy. You understand me? For these people, for you to continue to try to break and show, for example, that this is what you can get. You have to. We don't, in our process to create awareness, you cannot disregard the beliefs of people. You understand? Because eventually they would make their choice. You understand me? When you are no longer there, you cannot grab them for not bringing their child for immunization. You understand me? You cannot put them, this is their belief, and these are the things. So eventually when we talk about prevention, what does religious be? You attach yourself to stakeholders, you attach yourself to religious persons, you attach yourself to a community, people who could take time to listen, whom you could take time to explain, train, and involve in the process, so that they can go back, you understand me, to rationalize that information to their community.
But finally, your final word here now, how do we move from here? Finally.
So I think that for every situation, I think an immediate plan, a mid-term plan, and a long-term plan. And I'm saying it because of the region that we are trying to focus on. If we're talking about in general, some countries, rather some states, are getting it right. You understand, in terms of malnutrition and ensuring that there's food security, there's health facilities, there's awareness, there's all sorts, you understand. So, but because of this particular region, there needs to be in discussion. I mentioned one before that. For every military expedition should come with an humanitarian aspect of it, because when the military goes into this community to fight the insurgency, the displaced people, those people needs to be catered for. There needs to be a direction, you understand me, to for these people as well. And then you cannot talk about enough information being pushed out there, particularly in local languages or other means of communication, that these are the things that you are doing within your community. You understand me? The Nigerian Center for Disease Control has set out a lot some tools, you understand me, to assist states, you understand, to create the awareness, you understand, and pick up cases of malnutrition or infectious disease as well. So we just need to continue to commit to those already established rules, because these are the things that have shown to work. We just need to be committed to ensuring that what will go all the way.
All right, commitment being a major factor here. Thank you so much, founder safebody.com, Dr. Azizat Yishau, for your time.
Thank you so much for having me.